We're still in chapter 25, and this is on the clinical evaluation of the kidney. So, urinalysis is when just basically urine is examined for signs of disease, and it's also used to test for illegal substances. Now, assessing renal function requires both blood and urine examination. For example, renal function can be assessed quickly by measuring nitrogenous waste in the blood only, but to determine renal clearance, both blood and urine are required. Renal clearance is the volume of plasma the kidneys can clear of a particular substance in a given time, and renal clearance tests are used to determine GFR. They can help to detect if there's any glomerular damage or to follow the progress of renal disease. Renal clearance rate is calculated as renal clearance rate equaling the concentration of a substance in the urine times the flow rate of the urine formation divided by the concentration of the same substance in the plasma. Inulin is a plant polysaccharide, and it's a standardly used um, substance. It's freely filtered. It's neither reabsorbed nor secreted by the kidneys, and its renal clearance is equal to GFR, which is about 125 mils per minute. If the renal clearance rate is less than 125 mils per minute, this means the substance is reabsorbed. If it's equal to 0, that means the substance was completely reabsorbed or not filtered. If it's equal to 125 mils per minute, that means no net reabsorption or secretion. And if it's greater than 125 mils per minute, the substance was secreted. The chemical composition of urine is about 95% water, 5% solute, and nitrogenous waste include urea, which is going to be from amino acid breakdown. Uric acid is from nucleic acid metabolism, and creatinine is a metabolite of creatine phosphate. There are also other solutes that are often found in urine, like sodium, potassium, phosphate, calcium, magnesium, bicarbonate. Abnormally high concentrations of any constituent or abnormal components in the urine, such as blood proteins, white blood cells, or bile pigments, may indicate some sort of pathology, meaning that there's an issue. This is a table of abnormal urinary constituents, and I'm not going to ask you about any of these in lecture, but you do need to know some of them for lab. Typically, urine is clear. If it's cloudy, that may indicate a UTI or urinary tract infection. It's pale to deep yellow from a substance called urochrome, and urochrome is a pigment from hemoglobin breakdown, and the yellow color will deepen with increased concentration. An abnormal color like pink, brown, or smoky can be caused by certain foods, bile pigments, blood, or drugs. Whenever urine is fresh, it's slightly aromatic, but over time it will develop an ammonia odor, and this is because bacteria begin to metabolize the urea. The odor may be altered by some drugs or vegetables, and disease may also alter the smell, such as patients with diabetes may have an acetone smell to their urine. Urine is slightly acidic. An acidic diet, like a diet that is high in protein or whole wheat, can cause a drop in pH. An alkaline diet, like a vegetarian diet, prolonged vomiting, or UTIs can cause an increase in pH. And then we move on to specific gravity. And specific gravity is the ratio of mass of a substance to the mass of equal volume of water. So the specific gravity of water is 1. And urine has a specific gravity of 1.001 to 1.035, which means that the specific gravity of urine is higher than water. And the reason is because of the fact that urine is made up of both water and solutes. So that's the solutes are going to increase the specific gravity of urine. Here's your question for this segment. That is all I have for you for this video.